Hi, good afternoon, everyone. So I am Dr. Raj Kanna. I am here to introduce the Velis robotic system, which we are launching today at Prashant Hospitals, Chennai, India. So I am going to explain you some of the salient features of the system. This is the robotic system. There are multiple advantages of using a robo for knee replacement surgery, such as it can help in a better leg alignment. So when there is a better leg alignment, the functional results are going to be good, and the long-term longevity of the knee is going to be better and better. Secondly, the ligaments surrounding the knee joint, they are going to be balanced precisely with the help of the robo. The other advantages are the blood loss is less, and the complication rates like fat embolism or pulmonary embolism is less. So we can use this system not only for a single knee replacement, for also both knee replacements at the same time, and also in aged patients, obese patients who have higher than normal body weight. So in all these patients, when we use this robotic system, the complication rates are going to be very, very less. And so these are the advantages of using the robotic system. Thank you.